Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Welcome back to Open Mics with Dr. Stites. Cancer treatment rarely involves just one doctor. Patients typically see a team with different specialists for chemotherapy, surgery, and radiation, not to mention other specialists like cardio-oncologists for your heart health or oncocytologists for mental health. Today, we're going to ask a different question. Where does exercise and physical activity fit into this comprehensive, multidisciplinary model? And hint, it really does fit in. So how can people stay active even when chemo or radiation makes them fatigued? Can exercise actually improve outcomes? We're going to meet someone who has dedicated their career to answering those questions and has even helped write some national guidelines used by cancer doctors nationwide. We'll also meet a survivor who says exercise is what empowered her through her treatment. But first, let's do morning rounds. We're joined by Dr. Kamal Gupta, an interventional cardiologist and director of the vascular medicine program here at the health system and a major research physician. And he's here because the cardiovascular team just opened up a brand new space dedicated to clinical trial research. Dr. Gupta, this is not the start of cardiovascular research here at the health system. You've been doing it. We've been doing that for years between the medical center, the university, you, the health, all of us together. So how does this new space compare to what you've been doing? And tell us how it's going to empower your future.
Well, thank you for having me here. We are excited about the new space. We have a large team of clinical researchers, doctors, research nurses, coordinators, and they're all excited about the new space. It is very close to our clinical workspace. So the doctors who are principal investigators, our patients, our procedural spaces are all next to our team now. So it'll have easy access, more efficiency, and less walking for patients and less time. So we are very excited about this.
So you guys have really grown your clinical research trial portfolio recently. Give us some example of the clinical trials you're involved in.
Well, we are currently enrolling in or in follow-up in about 65 trials in our department, all in cardiovascular medicine, ranging from device trials to drugs and new therapies that may not come to use for 5-7 years. So to give an example, as you asked, Dr. Wiley is a PI of a study which is creating a little shunt within the heart between two chambers to offload the pressure so patients with heart failure who have no other options can breathe easier. And the results are really fantastic. And Dr. Mammon, who is the chief of our advanced heart failure team, is about to start a study injecting some stem cells in the heart of patients with a disease called Duchenne muscular dystrophy. So these are some of the examples of really innovative new things that we are bringing to our patients in the health system.
Yeah, that is awesome. And to our whole university and everyone around here. As you look to the future, gene therapies, we've heard about CRISPR, we've had in cystic fibrosis, they're trying to do all sorts of RNA trials, messenger RNA trials. What's in the future for cardiology?
There's a lot of excitement about gene editing, gene modification technology, and CRISPR can do more than just genome editing. The possibilities are beyond my imagination. So it's not actively being used, but there are lots of trials being planned, bench-side work being done, things like lipid modification. So CRISPR can help modify processing of cholesterol in the liver and lowering LDL in patients with genetically high LDL and other things. There are hopes for cardiovascular diseases that have a gene that cause it. We are a large center for a disease called hypertrophic cardiomyopathy, where the heart muscle becomes thick, and there's hope that CRISPR can be used in these patients. So I think the future in the next 5 to 10 years is very promising.
You know, Dr. Gupta, I'm always impressed. I have this certain awe every day I go into medicine about the changes that we see. I'm in awe of our patients. I'm in awe of the way the world's evolved. This is a great time to be in medicine. It's pretty exciting to hear you describe some of those things. Thank you for being here today. Thanks for being part of the health system and the university. Thanks for the great research work you do, and congratulations on your new space. All right, that's awesome.
Thank you.
All right, we also have some awesome and excellent guests for this discussion on physical activity during cancer treatment. Dr. Jeff Holzberlein is a urologic oncologic surgeon and the physician-in-chief of the University of Kansas Cancer Center. He's seated to my left, and he's been one of my doctors too. Dr. Julia White is a renowned radiation oncologist specialized in breast cancer treatment and research. And Marcia Francis is a breast cancer survivor and a patient of Dr. White's. Thanks to you both for being here. I understand, Marcia, that you were active before your diagnosis and still managed to stay active while going through full treatment. Now, full disclosure for all of our audience, Marcia works here on our social media team, which means when you send in your questions on Facebook or YouTube or anywhere else, it's either her or one of her team members who are responding. So thank you for your great work for the health system.
My pleasure.
For all of us. She's had to put up with me and all my kind of rantings here in the studio, et cetera, for all the time. So Marcia also worked closely with Sammy Mansfield, who is joining us remotely. Good morning, Sammy.
Good morning, everybody. So great to see you. Thanks for asking me and inviting me here.
We're delighted to have you. Now, Sammy is a cancer exercise specialist who has worked with various cancer centers, including the KU Cancer Center. Of course, that's been the best cancer center you've ever worked at, I'm sure, right? Yeah, absolutely.
Amazing.
All right, Sammy helped write
Really
the first ever guidelines for exercise, diet, and weight management during cancer treatment, published in the Journal of Clinical Oncology. It's a big deal. Before we jump into what that means, we sent a camera to follow Sammy and Marcia on one of their recent workouts. Let's take a look.
Yeah, there you go. All right, now I should kind of pick up the tempo just a little bit. How are your joints feeling since treatment?
Pretty good. My hip is pretty bothersome, my left hip.
Still?
Yeah, it kind of wasn't, and then it just kind of kicked in when I started having some other healing things that I noticed, and I just walk through it.
So we're gonna grab these, whatever position, that you can, and then all the way overhead. So what you're probably gonna wanna do is do that nice 45, or nice round, kind of Arnoldish.
Oh yeah. I like to lift weights because I feel it's a bit of a challenge, and I can feel the difference. I feel like I'm accomplishing something, and it also helps me in my daily life.
Do you think sometimes when people have a cancer diagnosis, it's like we take too many things away thinking we're helping?
There's kind of a balance, right? It meant a lot to me to feel like there was something that I could actually do and take action and not just wait for my treatment to work.
Exercise in my career has always been sort of that little nugget that people could do, anybody could do, because also exercise is free. And we have so many people that have like financial barriers and time barriers.
So true.
And I'm like, just work out in the chair. You know, here's your little bit of set of weights or whatever that may be. All right, we're gonna do some push-ups and really push away. Yep, make sure you're really squeezing your thighs so you have a nice strong core. Inhale down. Exhale up, those are really nice. Keep going. Now I'm gonna have you go ahead and kickstand that leg in. Good, yep. So we're gonna keep most of the weight in that left leg and then use this as a kickstand, and let's do those push-ups again. Yep, keeping that range of motion. This is actually a really good one.
This is usually where I take my glasses off.
Take your glasses off. And then as we're coming down and then all the way down, all the way up, feet a little wider. Yep, there's so many reasons I love working with individuals with cancer. I think probably one of the things that I love so much is about how willing and how passionate people are about wanting to improve their quality of life. I really believe people want to be strong, they want to be healthy, they want to be able to play with their grandkids and do things that mean something to them. We know that the majority of individuals after a cancer diagnosis will die from cardiovascular disease because we've reduced their muscle, we've reduced their overall cardiovascular health and conditioning.
They just get fatigued.
They get fatigued and they lose muscle mass, they lose cardiovascular capacity. And so we know that exercise plays a really important role.
All right, so first of all, what a cool place to work out. I'm just going to say, and you were doing burpees. Burpees are my nemesis.
Right?
Nemesis. All right, Marcia, you were diagnosed almost a year and a half ago. What were you doing for exercise before cancer?
I was taking some, and still participate in some CrossFit-like classes a few times a week, and then I do some cardiovascular kind of exercise, walking or bike riding.
So now you needed surgery, then chemotherapy, then radiation. So you had the whole thing going on.
Yeah.
What kind of physical activity did you do during all of that?
Well, you know, it started out, of course, you come back from surgery, and I worked out right until my last workout was 2 days before my procedure. And then afterwards, you know, you have to take some time to recover, don't pick up anything too heavy, that sort of thing. And I was in bed and thinking about what I could do, and I reached out to Sammy, who is joining us today, which I'm super excited about. And I was like, what can I do? And she's like, you can do a lot. You have a lot of control here. And so we started walking through mentally, those things that I could do. And just started with some body weight kind of exercises, but because I couldn't pick up weight doing body weight squats like I was there. Or later, after I was able to lift weights, starting to do my own sort of workout, and I found things on YouTube. You know, Sammy was talking earlier about like how some things are, there's so much available to us that's cost-free. And YouTube is a great, believe it or not, resource. Instagram, I follow a lot of cancer patients or people who do physical fitness afterwards, and picked up some things from them. So that's kind of how I got started.
That's awesome. And the working out, and I love what you say, you don't have to lose control of something you can control. How did the working out during your treatment, how did that make you feel?
It really made me feel like almost gave you a little mental boost afterwards. Of course, you know, then I go lay down. But
yeah. Well, listen, the endorphins are cool, man. You got to
Right.
go with the flow on that.
And certainly, you know, you feel differently. A whole host of other things that you can't control. But I had great care, a great team that if I, you know, was having difficulty with something, I could call my doctor or his nurse, and they would give me alternatives. But being able to do exercise, any kind of exercise in my home, or even just walking, no matter how slow it might be, it made me feel that I was alive and I was, you know, going to live through this, and you know that I had a lot of hope. And I think that that was really important for my care.
So, do you ever meet patients who feel like they should stop exercise during treatment?
Every day. Because I think, you know, patients aren't sure, their caregivers aren't sure. And there's this mindset, if my physician didn't tell me, I don't know, because there's so many questions and concerns, again, related to surgeries or treatments or harming themselves. And I think what we really need to remember is that just because you weren't told to exercise doesn't necessarily mean you need to stop. But, you know, truthfully, we have not had the research, especially to the capacity or the guidelines and the recommendations and the workforce to really promote that message. As we mentioned, even before we came on, and then again through this last talk with cardiovascular disease, things are growing and going at such a rapid tempo with cancer treatments that I think we need to remember that the clinical care team has a very specific job and role to deliver really comprehensive clinical care. And on top of that, you know, that rapid speed of how research is happening with exercise is coming to the forefront, but it hasn't quite been integrated yet because, as we mentioned, these guidelines that we are talking about today are pretty new, only 2 years old.
So, just to ask, is exercising outdoors in a shelter, is that part of the guideline? Because that was a pretty cool looking spot to exercise.
So I'm a huge fan of exercising outdoors for many reasons. I tell people it just feels good, but we know that you get different endorphins when you get outside. There is actually research looking at anti-inflammatory benefits and sleep benefits. And so I'm a big believer in let's just take our movement outdoors when we can. And I think it makes it a little bit more fun, especially as, you know, seasons change and we can finally get outside. So yes, I highly recommend it as well. And we can definitely provide the address.
Yeah, that's perfect. And, you know, that's what I call fly fishing and wading in a river. So, hey, we mentioned the ASCO guidelines for exercise, diet, and weight management during cancer treatment. What was the idea behind creating those? How did you get involved with all of that?
So the idea behind it was really taking what we know about exercise and cancer, which is everybody here, you, I, everybody in the room, everybody supporting this, watching this, we should all be striving to meet the exercise recommendations for every adult in the world. However, we didn't have specific guidelines reiterating the safety, the efficacy, the importance for individuals undergoing treatment. So what we were seeing is that we had cancer patients stopping exercise and physical activity during treatment. And then we were seeing in that kind of post-acute time, all of the detrimental side effects that come from inactivity, right? And so these guidelines really took the evidence globally and created a very specific resource to support the oncology care teams to say, yes, you should be exercising during treatment. We have the evidence, and now we can start to implement this as part of your entire cancer plan. I do think it's important to say, although these guidelines are only specific to patients in treatment of curative intent, the advanced cancer population although we may not have an exact guideline, was actually written into this particular guideline in referencing international recommendations that even individuals with metastatic advanced cancer should be exercising, and that the benefits outweigh the risks. We don't have prescriptive information of how much, but we're saying that every patient with a cancer diagnosis should exercise, and now we have the recommendations to do so. My role is fun. I get to work with all of the researchers on, okay, these are the guidelines, now let's implement them. So that's why I'm really excited to be here today, because guidelines are only as beneficial as we can make them available into the universe of patient care.
That's awesome. I love your work. That is, and I'm such a huge believer in exercise. And man, I tell my patients this all the time. I have end-stage lung disease, but everybody can get better. So activity doesn't have to mean lifting weights or running a 5K. You have routines that don't even require getting out of the chair.
Yes, indeed. So I thought it would be really fun if we demoed a couple of things today, since you are all chair-bound. So I think what we need to do, sit up. I know, it's going to be fun.
Oh,
so
I don't always sit up straight, but I got it.
Oh, yes, you do. Pull your belly button in, squeeze your booty. You'll notice that your hips kind of lift when you squeeze your booty. So everybody watching this, squeeze your booty, pull your shoulder blades back. And then I just want you to march. Now, you can't see my knees because we're not going to be moving around that much. But everybody there, I want to see your knees lift. Now we're going to press our arms forward like we're doing that really amazing push-up that Marcia did, which was seriously a legitimate push-up.
I'm ready.
Don't have to do that on a park bench.
Baby.
Oh, look at that. Yes.
Oh,
for anybody
gosh,
that wants to do push-ups, try them on your countertop. Now,
I already did
I want you to
today.
take your arms. Now I want you to reach overhead and back down. Keep marching, because this is like chewing gum and walking.
Hawkeye's in the
Now,
studio and he's
hold
not
those
doing it.
arms
Hawkeye,
up.
let's go. Come on, man. What are you doing?
I'm standing up.
Hold your arms up. Keep your knees coming up. Come on. Let's do a couple more times. Good. All right, relax. I actually think that chair exercise, when done correctly, is harder than standing because your core has to really work. So, yes. Good job, everybody. Kudos.
You know, Sam, you need to be back on this program every darn Wednesday, and we're going to have an exercise part of the program. We're going to have, there may be Hawk's Nest, but we got a little something with Sammy's time here to do a little time. I like that.
I love it.
All right, Dr. Holzberlein, what do you tell your patients on treatment about exercise and physical activity?
Yeah, we've been big proponents of that. Actually, we've done a fair bit of research into this. We work with Dr. Jill Hamilton-Reeves, who I know has been on this program before, really focusing on diet and exercise. And I think, as Sammy mentioned, we know the benefits of exercise. One of the early studies that we did was looking at the development of sarcopenia in patients who are being treated for cancer, and those who go on to
You got to
develop.
tell us what sarcopenia is.
Sarcopenia,
That's a big word.
Well, sarcopenia is basically muscle loss or muscle wasting that can occur certainly during cancer treatment, but in other conditions as well. It's poorly understood, actually, and really people don't understand why people develop sarcopenia, but that is oftentimes accelerated during cancer treatment. We know that patients that go on to develop sarcopenia have worse outcomes. They actually die more frequently than patients who don't. So again, suggesting that by exercising, by diet, and other things that we can do during cancer treatment to prevent the loss of muscle is really critical. We've done some exercise studies, we've done some dietary studies that have supported that.
And Dr. White, same questions. I know radiation can really sap energy.
It really
and
can.
Kind of take it away.
Especially in a patient who's been through surgery and chemotherapy. By the time they hit us, they come in tired and we make them more so. So we really kind of wear it down. And so I think the research is great, and we've had some really excellent examples of that here. But I think the importance of us, for me as a provider, is to kind of meet the patient in the space she's in. And I'm going to use she just because to breast cancer. So we have the patients who are come in with a background like you did, and we were able to say, yeah, continue. If you listen to your body, back off when you feel tired. I love these chair exercises. I would love a copy to give patients. So do what you can. Set your watch for 5 minutes. Do 5 minutes a day this week. Next week, do 7 minutes. So try to meet them where they are. And I think there's a big population out there who's never been an exerciser to start. And I think those are challenging for us to care for. So I'll say walk to your mailbox. Walk to your mailbox today. Maybe walk to your mailbox twice. It'll still be empty, but still walk there. So I think getting patients moving, because I think it's really important, this point about sarcopenia and deconditioning. We know that if you look at many studies, and if you look at a cancer patient 1 year later, almost all of them, if you measure their capacity for exercise, they're deconditioned, they're in worse shape, even though they might be a year later. So catching them, because it has such big implications for their overall health, their ability to keep off other diseases, particularly, we follow the lead of our cardiovascular doctors, diabetes, and certainly, and we're learning now, maybe even cancer recurrence. So I think, to me, it's take that message that Dr. Hosberlein has brought about research and bring it to everybody I see. I think we had talked about it up front.
Yeah, absolutely. And it was so helpful, being able to ask you, okay, at this phase, what should I expect? And to be able to, tell me, it's like, hey, that second wind, like when you get tired and you think you're going to push through, it's like, that's not going to happen. So I was really prepared for how to exercise and when to take it easy and when to push forward. So I really appreciate that.
Sarcopenia can occur with any really chronic and especially chronic wasting disease. Fair enough?
So with sarcopenia, one of the reasons that we see it so significantly in the cancer population is because they spend so much more time being inactive. So like Dr. White mentioned, we have to meet people where they are. One of the simplest things we can do is just try to encourage them to do something every hour. It doesn't have to be big. It could be going to the kitchen or whatever that may be, but reducing inactivity can help reduce that sarcopenia, because after cancer, what normally happens in a healthy adult in 10 years happens in 1 year after a cancer diagnosis. And that is one of the reasons that our population really struggles with fatigue and other chronic diseases, just because of that massive change in their activity.
Sammy, there's also some new research on something called myokines produced by our muscles. Can you tell us a little bit about that?
I love this new word. Just like we mentioned with sarcopenia, myokines,
sarcopenia.
it's fun.
You guys are just kind of all got your own kind of language going on here.
Well, it's exciting to see these words come up, and not just be siloed into, exercise only as an example. But myokines are really simply how I say muscles communicate with the rest of the body. So it's their language. We're speaking English right now, right? We're showing sign language. Those are languages. Myokines have a language. And what they do is they communicate with the brain, the rest of the organs, your joints. They tell you when to move, etc. So myokines are actually responsible for influencing things like our immune system, our overall metabolic health. We know that they actually can really help us with inflammation. So one of the things that I want us to think about when we're thinking about myokines is they come, this signal, this communication, when we move, when we activate them. And what we're seeing in the cancer space is that this communication is actually influencing tumor growth, progression, modulation, because muscles are helping to regulate some of the systems that contribute to some of our cancer diagnosis, largely related to obesity-related cancers. But the simplicity is we are still learning, like everything in science and cancer and metabolic health, that we know that there's a role related to obesity and muscle health and cancer, but we don't finally understand it. So I tell people, if you can continue to create that communication system, you're giving yourself the best overall health and function and quality of life opportunity. So again, they're just the language, but we don't get the language communicating if we sit. We have to activate those muscles, even if it's just doing a chair-based exercise or getting up every hour. So simple goal, just move.
I love that. Just move. All right, all right. We are here to answer your questions. Send them using the links on your screen, YouTube, Facebook, the X platform, or email the Medical News Network. Let's check in with Doc Hawk. All right, Hawkeye, what's going on out there today? How's the world? How's the whole infectious disease saying? What's turning?
Yeah, I mean, I think it's kind of calm right now. The big things, obviously, respiratory viruses are kind of out right now. SARS-CoV-2 circulation is very low. We know it is mosquito and tick season, so it is vitally important to wear your bug spray and protect yourself from mosquito and tick bites. We know that in Kansas, in the last 2 years, or actually 3, going back to 2022, the Kansas Department of Health and Environment has issued high-risk warnings for West Nile virus. We know that those infections do occur and can lead to death, so vitally important to protect yourself from tick bites and mosquito bites.
Yeah, that West Nile virus is something that without climate change we probably wouldn't have to be worried about up here. But as it's gotten warmer and the warm weather months have expanded, we're seeing more things like that. little concerning. What do you see is coming next?
Yeah, and I would agree with you. I think that and the ticks, just as you said, I think climate change, it doesn't allow for those hard freezes, those really cold weather, so those tick populations can stay high. And of course, with all the rain we're having, those mosquito populations can explode as well. The other thing, H5N1, avian influenza, we know that it is going through the dairy herds. We know that there's been one case, human case this year of H5N1 in a person who worked with the dairy herds. Nothing else at this point in time. We know that in Australia, just within the last day, there was a case as well of a returning traveler from India that went to Australia. That person did have some pretty severe disease, but is recovering now, and so far no other human-linked cases to that, so we are continuing to monitor that as well. And those are really kind of the big issues. But of course, we know that also there are these old infections and diseases, these vaccine-preventable infections, most notably measles, that is still out there as well.
So anything new on that whole K2 variant? I think I'm talking like it's a mountaintop, I know that, but K2?
Yeah, I mean, as far as COVID goes, nothing really. The variants haven't really been different in the fundamental disease they cause. I was just looking at the CDC data at this point in time. Obviously, their data collection is a little bit decreased compared to where it was. But overall, no really new severe disease or any changes in the disease that SARS-CoV-2 causes. We know that infection, reinfection, of course, vaccination has all helped with our population immunity and our individual immunity as well. Overall, we would like to continue to see these rates of infections and hospitalizations from SARS-CoV-2 drop, and so far, I think we're doing fairly well on the national scene, and then also mostly in our local communities as well.
All right. Thank you, sir. Awesome.
Yeah.
Always a pleasure to see you, Doc Hawk.
Yeah.
All right. I know many of you may have some questions. Let's head to Studio B with Alexis. Good morning, Alexis.
Good morning. I am
Hey, Alexis.
loving this program.
Oh, no kidding. And you're an exercise. I'm an exercise freak. Are you an exercise freak?
Yes. Well, I enjoy yoga and walking. I do those
Okay.
two pretty religiously.
Yeah, I got this whole program with Peloton and with my gym and things like that. You know, 5 days a week, 6 days a week, every week.
You're going to live forever. We'll have you here hosting this program till you're 100 when you finally retire.
Well, listen, here's the deal. If I don't exercise, my wife sends me out to exercise because I'm not as nice of a person either. That's the other health benefit. That's an important mental health benefit. Your spouse likes it.
That's true, too. That's true, too. Jean has an interesting question. Jean wants to know if these exercises would be good for men on hormones for prostate cancer, or would strictly weights be better?
Ooh.
Yeah, I'll take that one. So actually, both types are really critical. And I think one of the things that we're realizing in particular as adults age, even those without cancer, the value of strength training, whether that's body exercises like Sammy pointed out, or whether that's actually true weightlifting, is neglected. And we need to do a much better job of both weight training as well as aerobic training. So both are really critical. In men on androgen deprivation therapy, that is incredibly critical. It can be challenging as well. You're tired, you do lose muscle mass. Those things are inevitable with those types of treatment. But we also know that you can ameliorate some of those effects through exercise and diet. And again, some of the work that Dr. Hamilton Reeves has done has supported that. One of the things, too, that I love about Sammy's program is sort of challenging dogma, right? And I think that we've had this dogma out there for a long time about, not making people exercise or, letting people rest during cancer therapy. And I think these guidelines really challenge that. We actually, Marcia mentioned something I thought was interesting. We had this dogma for a long time that after a surgical procedure, you shouldn't lift something heavy. It sounds like you were told that. There's zero evidence for that, none. And actually, we've started a large trial here at the University of Kansas amongst multidisciplinary surgical things where we're going to let people lift whatever they want, whatever their body says that they can do.
What about the whole incisional thing and all that? No.
There's no data for that. There's no data to support that.
Just dogma.
And there's actually very good data that doing the weightlifting will help prevent lymphedema in the future, so in a very controlled way. And then everybody can start. You got to start somewhere, but that's a really good point.
Interesting. I love breaking dogma. Sammy, you're smiling. It's shaking your head. Blah, blah, blah.
This just makes me so happy. But, truthfully, when I started my career 21 years ago, we had no research. So now we have research, and yeah, we're challenging dogma. We're also challenging people that don't know in the community, and then they hear from others or they've heard about someone else's side effects. But I think one thing that I really want to add about, yes, strengthening and aerobic is important, but as we heard, most people are not exercising and meeting recommendations. Only 25% of adults in the world are meeting recommendations. Our cancer survivor population is lower. I tell them, just pick one thing to focus on right now. Right. And I think we should help them prioritize, as you all have done, what is that one thing? And that way we can help them be successful and not feel overwhelmed, but just give them something small and give them the reasons behind why that is so important. And I think that's what empowers our patients to continue.
Live long and prosper. Go ahead. Sorry.
Knew you were going to work in.
You knew it had to be coming. Yeah, heck yeah.
Jeremy has a follow-up question to what Dr. Holzberlein was talking about. Jeremy would love it if you could expand on any other commonly believed myths that patients have about exercising during cancer. I guess Jeremy has heard treatments could spread the cancer, that'll just compound your fatigue, which are myths.
Mm-hmm. That's a different myth.
Yeah, I mean, I think we've heard a lot from Sammy about some of the work that's being done and how that influences tumor growth. And in fact, I would say the data is pretty clear from what we have so far that it probably inhibits tumor growth. And whether that's through an inflammatory pathway through the myokines, I don't know that we completely understand what the mechanism is. So I really think that there's really not any evidence to suggest that it makes cancer worse. And certainly some emerging evidence that it helps us fight cancer. And then I think important to Dr. White's point a minute ago, one of the things we have to do is it doesn't make sense to treat people for cancer only to debilitate them so badly that they can't return to an active lifestyle or to a lifestyle that's enjoyable. So if we let them decondition so much during their treatment, they're so sick at the end of it, then they really don't have a good quality of life. So maintaining that quality of life, you mentioned metastatic patients, it's all about maintaining quality of life. We talk about living longer. We all want to live longer, but only if we're healthy living longer. And so that's, I think, another critical point.
So I think we've been talking a lot, if I may, about how important exercise is for your health. So it's like you don't want to rob Peter to pay Paul. We're going to treat your cancer and then increase your cardiovascular risk because we've sort of made a couch potato out of you. So that getting up and move, Sammy, I love that message. And I think the other important thing is if you look at the exercise data during treatment, patients have a better sense of well-being, their sense of hope, their moods. So it also helps them to feel better during treatment and feel better, more optimistic. So I think that's an important message. And I want to be clear again, as Sammy has pointed out, exercise doesn't mean you have to go to, lifting weights and you have to join a gym. It's just setting some goals of getting out there and moving for several minutes, how much time you can tolerate, and being increasingly keeping it as part of your routine. And when you get tired, rest, and then do it again.
That's so true. I was, had these expectations, of like what I'm used to being able to do. But really, as you said, meeting a patient where they are and realizing that where before you might have thought, oh, walk into the mailbox or walking a half a mile isn't a big deal. It is a big deal. It makes a difference. And as I've gotten better, to be able to return, and to enjoy that quality of life has been just paramount. I mean, that's the whole reason we go through treatment, right? Is to embrace our lives. So I really appreciate that perspective, and you can start wherever you are, and you can grow that passion. You can grow your health, and you can continue to be strong and enjoy an abundant life.
I just say it's interesting. Hearing this conversation, and it should be. It's a broad conversation with all sorts of patients and all people, really, even those with end-stage lung disease. I work a lot with patients with end-stage lung disease. This is kind of my thing, and we prepare people to go to lung transplant. Part of that preparation is exercise, and I will tell you that the evidence is absolutely clear almost any patient with end-stage lung disease. You can double their exercise capacity. You didn't help their lung just by putting them through a program of exercise and rehabilitation, which includes walking and weights. And it has a marked impact on survival at the time of transplant. So it is, you know, the evidence is just clear. Okay, Alexis, where are you at? And you probably have another question to ask.
One more question from Marie. Marie would love to know what is happening chemically in the body during exercise that helps fight the cancer. Dr. White mentioned exercise helps fight or prevent lymphedema. So what chemically is happening from the exercise?
All right, we'll open that one up.
So I don't think it's so much chemically as much as you're using the body's normal function. You're kind of bringing back the normal muscle. So we know, for instance, in arm lymphedema, which women who have breast cancer and other patients, you know, melanoma patients who have lymph node surgery or in lower extremity, we know that part of the way that we prevent swelling is to keep muscle. Muscle helps return fluid, lymphatic fluid back to the veins to get back to the heart and back into the circulatory system. So it's important to keep muscle. So what we've learned is, I think we at first that, you know, what we should do is tell people to not use the limb. You know, kind of, I guess, a baby, it would be a good word to say. You know, don't lift anything more than a jug of milk. We gave a lot of these instructions. We all did. But what we learned, it was a really beautiful trial. It was published in the New England Journal of Medicine about 10 years ago. It was a simple, Sammy, you probably know it better than I do, but a simple exercise of lifting, I think it was 5 to 10 pounds of weight, some very simple things that almost everybody could do, either standing or sitting. The group of patients who lifted the weights at 1 year had significantly less lymphedema and better functional strength. They could put their groceries on the table. They could put their suitcase overhead on the airline. So I think it's a really important message that not letting those muscles go to waste will help health overall and your ability to kind of just do your daily life.
Sammy,
I do think, I was going to say, I would add one thing. I think that's exactly correct. And I do remember the early part of my career. It was like, oh my gosh, we were so nervous about things. I think the chemical reaction that we should also mention that we do understand is the neurochemical reaction of exercise, that feel-good feeling, that emotional well-being, that piece of hope that we can't quite measure. That is a chemical reaction that comes from exercise of any kind. So I think that piece is really useful to this population as well as all of us. But from, you know, as we said, from a cancer perspective, I don't think we really understand that. Maybe we will in my lifetime, maybe we won't, but we know it's beneficial. So I think it's key to mention also the brain side of this too.
You know, our patients say, well, I don't have this weight, I don't have that. I'm like, you got a couple of cans of beans, let's go. You could do it all on your own body weight. There are so many great forms of exercise that are open and available to all of us. This has been a great discussion. And I am grateful to all of our guests for being here. I want to hear final thoughts before we go. Sammy, you're awesome. Come back anytime. I think, guys, I'm talking to the studio team. We need to focus more on this exercise theme here and help work people. And maybe I'll come dressed in my gym clothes, which will not be pretty, but maybe Hawkeye will be here. Sammy, final thoughts.
My final thoughts, I want to say one thing. First of all, as someone doing this career as long as I have, I love hearing all of you talk about this, my passion, with such enthusiasm, because patients like to hear what I have to say, but they especially love to hear what you have to say. So that makes my heart so happy. I think the one thing that I'm going to tell the audience, if you're excited about exercise and you go to like Google or whatever browser you use, you know, breast cancer exercise program, it does not exist. It will never exist because you are you. And I want you to think about, what do you like to do? Maybe what do you not like to do? Emphasizing your goals and priorities. I would really reiterate strength is the most underutilized tool in your tool belt and has the best benefit. Start with your body weight, right? But start. But don't Google looking for the exact program and then go, that's not mine. Find what you love to do and just do it. So, no, and thank you so much. This just makes my heart very, very happy to be here and hear all of you.
Yeah, it is just true. Okay, Marcia, thank you for being here, and what an awesome story you have.
Well, thanks. I had a great care team. I can't say enough about my medical oncologist, my surgeon, and of course Dr. White, my radiation oncologist. Just everyone, from the person who checked me in all the way to the people who, you know, the physicians who gave me care, the best, absolutely the best. I can't help it, had to say that. But, you know, I think what Sammy, you know, underscores and what the everyone here has said is the best exercise is the exercise that you do. What do you love to do? And trying to start, you can start wherever you are and start with something you like. You're more likely to do something that you like. Don't eat the vegetable that you hate. Eat the one that you like. Start there.
Yeah, it does make a difference. Dr. White.
Well, I guess the same is that we've got really exciting research to understand where exercise means in terms of preventing cancer, controlling cancer outcome. But I think working with our patients to see that it can stay part of their routine during treatment, and also try to hopefully engage those patients who haven't been exercising to do what they like so they can become more active and give them a better health benefit.
And it is just, you just feel it, don't you? I suspect we all are exercisers here, so Olsby.
You know, one of my favorite terms lately is functional fitness. It's one that I've been really sort of, I love, and that's, mowing your yard, that's raking your leaves, it's doing any of those things, and there's fitness in that. And so, we've heard a lot about whether it has to be lifting a can of beans or exercise, whatever it is, whatever you enjoy, I think, as Marcia said, is great. But remember, just in the simple tasks that we oftentimes do around the house in the yard, that's functional fitness, and I love that idea.
It is awesome. Hawk, I know you are a big exerciser.
I try when I get time. When I'm not in the hospital, and I'm going to Olathe now after this to see patients there. But yeah, I mean, I think healthy lifestyle is so hard to come by in today's day and age and in our society, and not work-life balance, but just like to say balance is so hard to come by. And I think it is important. I love this message today. Very important, continue to try and get adequate, good nutrition, good rest, and of course, physical exercise as much as you are able to. And lately, the weather's been pretty nice, so if you can get outside, please do that as well. And protect yourself from mosquito and tick bites. Wear long clothes, long sleeves and pants, and of course, bug spray for that as well.
Here's what I know. Exercise can be the surprise gift of your life. It's interesting to me. I went through all these things all these years, and my daughter dragged me to this bar class. They have bars for dancers, right? Holy cow. My low back and hips have never felt better. They got the advertisement all wrong. You need to be doing bar class because hip mobility is such a challenge as we get older, and getting your low back, I'm like, my back feels so much better. Start doing them 2 or 3 times a week. So what a surprise. What a surprise that you can do these things and you can feel better than you've done before. And ultimately, that's always the goal of great medicine. It should be the goal of great health care. Thanks again to all of our guests and to our audience. Remember, faith, hope, science, and get your move on. We'll see you soon.
Nearly 39 million Americans are living with diabetes. I'm Alexis Del Cid. On the next All Things Heart, we explore the link between diabetes and heart failure and how to prevent that from happening to you.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.